Access to health services should be a right and not a privilege, according to Professor Alexandra Martiniuk, who has spent her life improving child health.
When I saw the inequities in how healthcare was delivered to children in developing countries compared to high-income countries, as well as within countries, so rural kids versus city kids, I got very interested in ensuring that the top quality care reached all kids equally.
A psychologist and epidemiologist, Professor Martiniuk uses maths and statistics to find answers to child health problems around the world. In Africa, she worked with the World Health Organization to reduce the number of babies contracting HIV and AIDS from infected mothers.
The science existed to stop the transfer of HIV from mothers to babies, and yet across Africa, Asia, Central America, this was still happening, and nearly 100% of babies would be born with HIV to an HIV mom.
From 2009 to 2018, Professor Martiniuk worked with Malawi healthcare workers and reduced HIV transmission rates from infected mothers to babies to about 3%. Now, more than 100 low and middle income countries use their model of care.
That was one of the biggest projects I think I've been involved with. A lot of collaborators and partners, of which I was very proud to be a part.
Now she's working with children in remote parts of Australia and also with Indigenous communities, with her latest project in Fitzroy Crossing, Western Australia.
We're going to be helping the community there to work with the kids who have fetal alcohol spectrum disorder and other neurodevelopmental disorders to help those kids reach their full capacity, reduce incarceration, and reduce their poor health.
Professor Martiniuk is being awarded the Gustav Nossal Medal.
There's a huge sense of satisfaction in doing this work, in particular for vulnerable children who are often forgotten and live very difficult lives. And I have great love and empathy for the children who my work can potentially affect or does affect for the better.